During the flu season in the United States, there are hotspots, areas where more hospitalizations and even deaths occur. The goal of this project is to send temporary staff to those places to minimize serious complications and death. This analysis has been created to determine where, when, and how many. These are the 10 states most affected by the flu. They're gauged in the amount of visits to clinics and hospitals and in the amount of deaths in the year of 2017. That's the last year we have data for. As you can see, these are the deaths, these are the visits, and if you click on them, then you can see the details for each individual state up here. Deaths, visits, you can see total population, and the population over 65, which is one of the most vulnerable populations for death in flus. This is a good page of the presentation if you'd like to click around and dig into the data. Recommendation is to send the staff to Florida, New York, California, Texas, and Illinois, in that order. The order is almost the order in the chart, which documents the amount of death and visits. But California and Texas have been switched. This is because California has more deaths than Texas, but it has less visits than Texas. Although there was a weak to moderate correlation between visits and death rates, it's worth exploring the possibility that with more medical visits available, some deaths might be prevented. These are the top 5 most affected states by the flu from 2009 to 2017, with a forecast into 2018. You'll notice that all the forecasts are flat, except for Florida, which is trending upwards. So this is another reason to put Florida first on the list. When to send the staff? The first week of October. As you can see, that's when the surge in flu just starts to rise. This is a good time for the staff to go because they'll have time to get familiar with their colleagues, the population, and help with preventive care. This is the optimal window for flu vaccination according to the CDC. They can also help with education. They can let patients know what symptoms to look for to figure out if there are warning signs to go get help, and they can let them know where to go to get that help. Finally, it's preferable to send staff who speak or are familiar with the language spoken by the patient population. And if the staff needs communication materials, the CDC provides it here and in Spanish here. So let's talk about limitations to our data. The data didn't include flu death information after 2017. Also, all the information about flu fatality in children under 5 was suppressed. This is a drawback because children 5 and under are especially vulnerable to the flu. Recommendations on next steps is to run the same analysis on the upcoming flu season and compare it to our current numbers before making staffing decisions for the next flu season. It is important to note that because of COVID, numbers from the last flu season are lower than usual and can't realistically be used for future analysis. Thanks for listening.